The rationale behind our study was that we noticed that patients who are implanted with subcutaneous implantable defibrillators have a higher inappropriate shock rate than reported in transvenous ICD studies. And we noticed that the phenomenon that causes the inappropriate shocks is related to cardiac oversensing. And our study evaluates a new algorithm that controls a filter that specifically targets that phenomenon by reducing the T waves and basically filtering away T waves and therefore making oversensing a less likely phenomenon. So the filter is a high-pass filter that basically makes use of the fact that T waves have a lower frequency than QRS complexes. So if you block the lower frequencies, you kind of reduce the amplitude of those signals, and that helps to make sure that the device detection algorithm only detects QRS complexes and discards T waves. So this study was not a randomized trial. It was an observational study using data from the remote monitoring network, so the data that patients transmit from their home to the hospital. And using this data, we could study this phenomenon in a large group of patients and have very complete data. So it's really an observational study that evaluates the effect of the filter when it's turned on. Patients who had the filter turned on at implant were 50% less likely to get an inappropriate shock. And in absolute numbers, that means that from 1 in 10 patients receiving an inappropriate shock during the first year of follow-up, that went to 1 in 20 during the first year of follow-up. We know that patients who experience inappropriate shocks can have more than one inappropriate shock. Some have several in a row. Now, every shock matters to patients because they're a very uncomfortable experience, and patients are awake, so they feel every shock. We noticed that when we looked at how many shocks patients received, there was a 70% reduction when patients actually received an inappropriate shock. So not only are there fewer patients, the patients who receive inappropriate shocks get less shocks. So I think the implications for clinical practice of this new algorithm are that it's going to be a huge benefit for patients because they're going to experience fewer inappropriate shocks. And for clinics, it's going to be very easy to make use of this algorithm by simply turning the filter on in the devices when the patients show up in the clinic or when they are just implanted. So it's very easy to use and available in every S-ICD today.